Has someone close to you been showing small but worrisome changes over the past year? Many people think that old age ends suddenly, but the truth is the body often gives quiet warnings months, or even a year, before life reaches its final stage. The challenge is that these signs are easy to overlook. At first, they seem like minor shifts, nothing out of the ordinary. But later, looking back, families realize the clues were there all along. Only by then, it's too late to prepare, too late to make the most of the time left. In this video, we'll go over 5 key signs that often show up a year before an elderly person passes away. Some of them may be things you've noticed but dismissed as normal aging. Others might seem small, but actually signal the body's slow decline. Recognizing these signs early gives you the chance to offer better care, create lasting memories, and most importantly, ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us to the end. These 5 signs can help you prepare both emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. Instead, you'll be able to cherish the time you have left with those who matter most. Let's begin. Number 1. Noticeable weight loss. One of the earliest and clearest signs that someone may be entering their final year of life is unintended weight loss. At first, it may seem minor, a belt that needs tightening, clothes fitting more loosely, or a once healthy appetite that starts to fade. Many families assume this is just a normal part of aging, but in reality, losing weight without trying is rarely a good sign. This often means the body isn't absorbing nutrients as well as before, muscle mass is shrinking, and essential systems are slowing down. While some muscle loss happens naturally with age, rapid or unexplained weight loss signals something deeper at work. The body may be struggling to digest food properly, or it might not be able to process protein efficiently, leading to muscle deterioration. This loss of strength not only makes movement harder, but also increases the risk of falls, weakens the immune system, and makes the person more prone to infections. Another key reason for weight loss in the final year of life is a shift in appetite. Many elderly individuals stop feeling hungry the way they once did. Their sense of taste diminishes, food becomes less appealing, and they may begin skipping meals or eating much smaller portions. This isn't just a personal preference, it's a biological change. As the body prepares to slow down, it stops sending strong hunger signals to the brain, leading to lower energy levels, decreased strength, and an overall decline in health. Underlying health conditions can also play a role. Chronic illnesses like cancer, heart failure, or kidney disease often cause weight loss long before more obvious symptoms appear. Recognizing these changes early can help families provide better care and ensure their loved ones receive the support they need during this stage of life. Certain conditions, such as depression or cognitive decline, can lead to decreased appetite, creating a cycle where the body isn't getting the nourishment it needs to sustain itself. Families often try to help by encouraging their loved ones to eat more, offering favorite meals, or adding protein shakes to their diet. But if the weight continues to drop despite these efforts, it's important to recognize that the issue goes beyond food. It's the body undergoing a deeper transition. At this stage, pushing large meals may not be the answer. Instead, prioritizing comfort, offering easy-to-eat foods, and ensuring proper hydration can do more to support overall well-being. The focus should shift from simply increasing food intake to maintaining quality of life in the most gentle and supportive way possible. If you've noticed significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to take notice. This isn't just about physical appearance. It's the body sending an important signal. Recognizing this now allows you to prepare with understanding, compassion, and the ability to make every remaining moment count. Number 2. Severe fatigue and weakness. One of the clearest changes in the year leading up to the end of life is a deep, ongoing exhaustion that doesn't improve with rest. This isn't just feeling a bit tired after a busy day. It's an overwhelming fatigue that makes even the simplest tasks feel difficult. Getting out of bed becomes a struggle. Walking across a room takes effort. And once routine activities like dressing, cooking, or even having a conversation start to feel exhausting. This isn't just a normal part of aging. It's a sign that the body is conserving its limited energy. As organ function slows down, the body starts focusing only on what's most essential. The heart may not pump as efficiently, circulation weakens, and muscles don't get as much oxygen as before. That's why many elderly individuals in their final months feel increasingly weak, unsteady, and unable to keep up with daily activities. Another reason for this extreme tiredness is a slowdown in metabolism. Normally, the body produces and uses energy to fuel movement, but as it enters its final stage, that energy is redirected toward preservation. This often leads to more frequent naps, longer periods of sleep during the day, and difficulty staying awake for extended periods. Some people may even have sudden energy crashes, seeming fine one moment, only to be completely drained the next. Perhaps the hardest part of this process is its emotional toll. Many seniors who once took pride in their independence begin feeling frustrated or even embarrassed by their lack of energy. They may withdraw from conversations, avoid social interactions, or lose interest in hobbies. Not because they don't care, but because they simply don't have the strength. Recognizing this change can help families offer support, patience, and understanding during this difficult time. This can create a cycle of isolation, where they stop trying altogether, which only speeds up their decline. For families, watching a once active and engaged loved one become exhausted and withdrawn can be heartbreaking. It's easy to assume they just need to push through it or that they're not trying hard enough, but the truth is, forcing activity won't change what's happening. What matters most is recognizing their limits, allowing them to rest when needed, and focusing on making their remaining time as comfortable as possible. If you notice a loved one experiencing deep, ongoing fatigue that doesn't improve with rest, take it as a sign that their body is going through a significant transition. This is the time to have meaningful conversations, create moments of peace, and offer support without expecting too much from them. In the end, what truly matters isn't how much they can do. It's that they feel loved, understood, and at ease. If you're still here and finding this information helpful, comment too below to let me know you're watching. And if you haven't subscribed yet, I encourage you to do so and turn on notifications so you won't miss future videos. Your support helps us continue creating content that informs and inspires. Now let's continue. Number 3. 3. Increased confusion or social withdrawal ****. As someone nears the final stage of life, one of the most noticeable changes is in how they think, communicate, and interact with others. A person who was once sharp and engaged may start forgetting things more often, struggling to follow conversations, or seeming disoriented even in familiar places. They might repeat themselves, forget names, or lose track of time, even if they never had memory problems before. These subtle cognitive shifts can begin months or even a year before passing. This isn't just normal forgetfulness. Like every other organ, the brain relies on a steady supply of oxygen and nutrients to function properly. But as circulation slows and oxygen levels drop, cognitive abilities begin to fade. A loved one may become easily confused, struggle with decision-making, or even have difficulty recognizing people and places they've known for years. In some cases, they might have brief moments of clarity followed by sudden episodes of disorientation, almost as if their mind is flickering in and out. Another major change is emotional withdrawal. As the end of life approaches, many people lose interest in socializing. You might notice them speaking less, interacting less, or sitting in silence for long periods. This isn't because they don't care about their loved ones. It's because their brain no longer processes emotions and connections the same way. Conversations may feel exhausting, noisy environments can become overwhelming, and over time, many seniors retreat into their own inner world. You might also notice shifts in mood and behavior. Some people become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or uninterested in things that once mattered to them. This isn't just a change in personality. It's often the brain adapting to the body's gradual decline. As cognitive function slows, emotions become harder to express, and the person may no longer react to situations the way they once did. For family members, this stage can be especially heartbreaking. Watching a loved one become distant or lose touch with reality can feel like losing them before they're truly gone. But it's important to remember that this isn't something they can control. Instead of trying to pull them back into conversations, the best approach is to meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, more confused, or less engaged, don't overlook it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, treasure quiet moments, and create an environment that feels safe, familiar, and peaceful. Because even when words begin to fade, love and comfort can still be deeply felt. Now let's continue. Number 4. 4. Frequent infections and slow healing ***. As the body begins to slow down, one of the most noticeable physical changes is a weakened immune system. Someone who rarely got sick before may now seem to catch every cold, flu, or minor infection that goes around. Illnesses that used to be mild now take much longer to recover from, and even small wounds, like a cut or bruise, may heal much more slowly than before. These changes aren't random. They're signs that the body is struggling to defend and repair itself as it once did. One of the biggest concerns is recurring infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently or take longer to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person might require stronger medications, extended recovery times, or multiple treatments for infections that would have once been minor. Another issue that's often overlooked is chronic wounds. If small cuts, sores, or bruises aren't healing properly, or seem to reopen repeatedly, it could be a sign of poor circulation. When blood flow is compromised, oxygen and nutrients can't reach the skin and tissues efficiently, making healing much slower. For those who are less mobile, pressure sores become a serious concern and can lead to dangerous infections if not managed properly. What's even more concerning is that infections in the final year of life often don't present in the usual way. Instead of developing a high fever, an elderly person might simply seem more fatigued, more confused, or uninterested in eating. In fact, for seniors, a sudden decline in mental sharpness is often one of the first signs of an infection, appearing even before more obvious symptoms. This is why noticing these subtle changes early can make a big difference in the level of care and comfort they receive during their final stage of life. For families, watching a loved one battle repeated infections can be both frustrating and heartbreaking. It's natural to want to keep trying, one more round of antibiotics, one more hospital stay, hoping that the right treatment will turn things around. But at a certain point, the focus often shifts from trying to cure to ensuring comfort. Keeping them hydrated, maintaining clean and moisturized skin, and reducing unnecessary stress on their body can often do more for their well-being than another medical intervention that may only prolong discomfort. If you're still watching and finding this information helpful, comment below to let me know you're here. And if you haven't subscribed yet, I encourage you to do so and turn on notifications so you don't miss future videos. Your support allows us to continue creating content that informs and inspires. Now let's move forward. Number 5. 5. Significant changes in breathing or circulation ***. One of the clearest signs that the body is entering its final stage is a noticeable shift in breathing patterns and circulation. You may observe that your loved one is breathing more slowly or shallowly than before. At times, there might be brief pauses between breaths, or their breathing could become irregular, speeding up and then slowing down unpredictably. Some individuals develop a distinct rhythmic breathing pattern known as Cheyne-Stokes respiration, where deep, rapid breaths alternate with long pauses. These changes may start subtly, but tend to become more noticeable and frequent over time. Another common sign is weakened circulation. You may find that their hands, feet, nose, or ears feel unusually cold to the touch. Their skin might take on a pale, bluish, or mottled appearance, especially around the fingers and toes. This happens because the body is prioritizing blood flow to essential organs, reducing circulation to the extremities. It's a clear sign that the heart is not pumping as effectively as it once did. Shortness of breath can also become more pronounced, even with minimal activity. Simple actions like sitting up, speaking, or shifting positions may leave them feeling winded. They might start breathing through their mouth more frequently or need to pause to catch their breath while talking. If they were once able to walk short distances with ease but now struggle, it could indicate a decline in lung function. In some cases, fluid buildup in the lungs can make breathing even more difficult. This may lead to a persistent cough, gurgling sounds, or a sensation of chest tightness, making it harder for them to breathe comfortably. Many people assume it's just congestion from a cold, but for elderly individuals nearing the end of life, it's often a sign that the lungs are becoming weaker. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to help them breathe more easily. For family members, noticing these changes can be unsettling. It's natural to want to help, encouraging them to take deeper breaths or worrying that something serious is happening. But in many cases, this is simply the body's natural process of slowing down. While these changes may not always be reversible, there are ways to ease discomfort. Keeping the room cool, using a humidifier, or offering small sips of water can make breathing a little easier. In some cases, medications or oxygen therapy may provide relief, but the focus shifts from fixing the issue to making them as comfortable as possible. If you see these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay close attention. These are often signals that the body is conserving energy and circulation is slowing. This is a time to be present, offer reassurance, and create a peaceful space where they feel safe and at ease. In these final weeks or months, the most meaningful thing you can provide isn't medical treatment. It's comfort, dignity, and the assurance that they are not alone. Final thoughts. As we wrap up this video, take a moment to reflect on what we've covered. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the final year of an elderly person's life. They don't always happen all at once, and they may be easy to overlook at first. But when you start to notice them, it's a signal that the body is preparing for its final transition. For many families, accepting these changes can be incredibly difficult. It's natural to want to fight against them, to encourage a loved one to eat more, stay active, or push through their exhaustion. But sometimes the most compassionate thing we can do is simply listen to what their body is telling us. Instead of trying to reverse the inevitable, we can focus on making their remaining time as comfortable, peaceful, and meaningful as possible. Recognizing these signs isn't about fearing death, it's about being prepared for it. When you understand what's happening, you can provide better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with dignity, love, and presence. This is a time for sharing stories, cherishing moments, and reminding them that they are valued and never alone. If you're noticing these changes in someone close to you, take a deep breath and remember, you're not alone. Many families have walked this path, and while it's never easy, knowing what to expect can help you navigate it with strength, patience, and peace. Thank you for being here today. We'd love to hear from you. Share one thing you learned and how you plan to apply it in your life. Your insights matter, and reading your comments inspires and motivates us. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating meaningful content. Thanks for watching, and we'll see you in the next video.